Thank you very much. Merci beaucoup, everybody, to be here. And last time in the Zoom meeting, Javier, who is working, he will present himself, and he's a stroke survivor, um, proposed to give a presentation on implication on aphasia in daily life with professional and survivor experience. That's why he thought it was good, very interesting, and we thank you very much for that. The conference will be in English and la conférence sera en français, la conferenza sarà in italiano, no, la conférence sera en anglais, la conferenza sarà in inglese, but you can use the translation in Zoom if you to follow that, and it will be recorded. We try to put that on the YouTube system of AIA after that. Thank you.
Yeah, also,
Javier.
since I can speak Spanish, at the end we can help or try to manage comments or questions in Spanish and I guess French and English. So that's the wonderfulness of having a
Silvia from Argentina is there also. She will try to follow.
Okay. Bienvenida.
Des trois petits points en bas, affichage des sous-titres. En français, il va y avoir une traduction automatique.
Od afazista nekje svetovna neka predstavitev, če bom kaj sploh razumela.
Schlüssel von 5 Kilo Kokain. Heute Morgen reingekommen. Also wer von euch schmuggelt das Zeug aus dem Markt?
Now I invite all the people to cut the sound. So j'invite tout le monde à fermer le son. So Javier can start. Invito tutti a togliere il suono.
Jean-Marie, excusez-moi, Jean-Marie, c'est toi qui as le contrôle du Zoom?
Actuellement, oui, bien que je l'ai donné aussi
donc
à Javier.
Tu pourrais fermer les micros de tout le monde.
Oui, sauf celui de Javier.
Ouais.
Would you like me to start, Jean-Marie?
Yes, you can start. You can open the sound again, Javier.
You can hear me now?
Yeah.
Okay, thank you. So, as you see, this is the little title, The Implications of Aphasia in Daily Life. And I'm very happy to be here and say, good morning, good afternoon, or good evening, whichever country or time, our time or time you are connecting to. And today, what I'll start is with who am I and how I got here, and the consequences of aphasia from a perspective of a clinician, which is what I am also, and a survivor, which is also what I am. And we'll have some questions and discussion at the end. And a disclaimer about me is the presentation is educational, so it's not to be considered treatment or diagnostic. I think in attention to the fact that including me, actually, we're not native English speaker. I try to be a little slow or mindful of my pronunciation, apart from my aphasia, and also by reading a little bit, maybe a little boring, but it may be helpful for people that have aphasia to understand a little better. And I don't know if I'll be able to manage all the questions during the presentation, but at least we can take care of that at the end. Thank you. So as I said, I do have aphasia, and aphasia goes, I can get into me a little bit, and I'll take a little breath, and then I'll continue. So today, talk draws from my experience as both a professional and a survivor. And as I said before, let's try to keep, if possible, the questions for the end. Okay. So this is what I do for a living. I was able, after a couple of years after the stroke, to reopen my practice, my office. And this is what I do, psychotherapy. And I have 25 years of experience working with adolescents, adults, families, and private practice in Arlington, Virginia, which is very close to the capital, to Washington, D.C. And that's where I have a lot of my experience with social service agencies, hospitals, and other groups too. And I grew up in Spain and Latin America. And since March 2020, I'm a stroke survivor. It's been actually a progression. I guess everybody knows that things don't happen overnight. But one of the things that I wanted to note is that in the February meeting of AIA, I was very impressed to hear from, I think, Alexia and other people, topics that people were considering important to investigate or study, etc. So in my speech, I think I touched some of those, I think, but they may be common concerns for the aphasia community. And also, I think my attempt is a little bit to bridge a little bit of more understanding and knowledge between our two continents, that would be the American continent in the whole, and Europe, and who else maybe join. So, and as I said, or the slide says, my perspective is based from living and practicing in the United States and Latin America. So that just is a statistic, which is basically what it shows how many people have aphasia. It says 2 million people in the United States. It's probably by now more. And I think everybody knows pretty much by now what aphasia means and what implicates. So this is borrowed from the Aphasia Research Library. I thought it was good to have that clear understanding of what we have here. So the connection between aphasia and stroke. So aphasia is a communication disability. It occurs from brain damage, and it's most common stroke. And aphasia can make it difficult to speak, understand, and read and write and use numbers. So aphasia can make it difficult to take part in daily activities. And for the talk today, I want this thing between recovery from TBI with traumatic brain injury and stroke. There's a whole set of statistics about TBI, but maybe in this discussion we can talk about it later. So surviving and thriving with brain injuries. Brain injury is complex, and because the symptoms vary from person to person, and there are many underdiagnosed, in my view, and untreated social and mental health problems common to stroke survivors. So holistic brain injury combines a multitude of factors, some biological and some social. This is some statistics of the United States, strokes and traumatic brain injuries. So every year, more than, I think by now it's past 800,000 Americans have a stroke. And another 1.5 million people sustain a traumatic brain injury or TBI, and that takes all kinds of forms, as in a sports injury, car accidents. I have a very dear friend that actually helped me start doing a little research and presenting educational conferences that had a traumatic brain injury, and they does have aphasia, which TBI tend to be a smaller group of aphasia. But anyways, so over the course of a lifetime, 4 out of every 5 Americans will be affected by stroke. So that's quite yeah, I said Americans. Yeah. Yeah, American families, rather. My wife is here, so she'll kind of pitch in to remind me. Thank you. So now, neuroplasticity. How long does recovery take? So neuroplasticity is the brain's ability to create a new neural pathways. And science and experience are proving that neuroplasticity continues with the right stimulation. So previously, the medical community, at least around here, held that the most of the recovery took place in the first 6 months, and slowed recovery up to a year post-injury. So little or no improvement was thought possible after the first year. Now, enter the U.S. insurance companies that they used that time frame to end post-trauma treatment after 1 year, and that's just to make a comment. The system, if people don't know it, in the United States, I would call it very fractured in terms of healthcare. And for the most, is managed by insurance companies, and each company has different plans. So it's really myriad of plans and conditions, and so money has to do a lot with it. It's not like the systems that you have, say, in Health Canada or many countries in the European Union and some parts of Latin America. So that affects a lot of delivery of healthcare and the type of healthcare that people get or not. So going on with neuroplasticity, how long does recovery take? So this book is pretty well known here, but it's called My Stroke of Insight, written by Jill Bolt. And Jill Bolt is a Harvard trained brain scientist, and she was 37 when she had a massive stroke, and she was able to observe, she says that in her book, her symptoms and understand what was happening in her brain in real life. So she writes about her experience in this book, as I said. For whatever is interesting, the book is translated into, I think it's 13 different languages. You can see that in the slide. And later on, as I told Jean-Marie, I can pass people the information and references that I have for this presentation, so as to be helpful to people too. So my my perspective as a survivor is that the changes in the brain will impact many parts of the life of the survivor and the family. So it's not just you as an individual. And surviving after a brain injury, each person that sustains a brain injury, in effect, has a separate condition of their own. So there's a loss of identity that I will get into in a minute. There's grief for loss of the previous life, and new fears associated with loss through trauma. Social issues like loss of income, jobs, housing, divorce, transportation can be present there. And accepting the new you, to call it something, that you may never get back to the pre-injury condition. So in quotes is the new you, and then I'll talk about that a little later, and also the new narrative. Now, so living with a brain injury, this is the clinical perspective. As I said before, every brain is unique, and every injured brain is unique, and that has a lot of consequences for care or recovery. So there's not a straight path to recovery. So psychosocial issues can exist for extended periods of time due to catastrophic losses and managing grief. So navigating systems, particularly in my experience here in the United States, that be systems, social systems, healthcare, insurance, pension, offset through long-term disability. Some people may have those plans here. Is very challenging. I think you become some type of case manager as a patient, or your family does. So my perspective as a survivor is that the survivors and this is from my experience here, and their families need clear information about the changes caused by the stroke and what the practical impacts are in ways that connect with the daily challenges they face or we face. So the family and significant others, that be friends, neighbors, co-workers, associate people, need to be included in the post-stroke education. Many of you probably know, if not all of you, how isolation is very common in this situation. And many general practitioners, in my view, medical speech therapies and psychotherapies do not seem to know much about the biopsychosocial dynamics after a stroke. So my perspective as a clinician, so I do psychotherapy and associated to mental health and just give me a minute there. I think they can see. And rehabilitation, those services should be a part of the stroke and trauma survivor recovery, and often is not. So that leaves a lot of vacuum in the recovery road. So here's some common emotional and personality changes. There is what you can call altered emotional regulation, the loss of filter. That would be the way you usually in normal times you're able to manage your emotions, you deal with people, and respond appropriately. Well, there's a lot of loss of these filters, so you can get very labile or up and down. and there may be also difficulty recognizing emotions in others. There's a slide on the side from the European Stroke Organization, underlining the emotion and recognition was impaired in 33.5 of patients. That would be also in the references later on. So anxiety occurs through that changes related to the stroke can lead to worry and anxiety. That's just a few details in terms of the things that can cause anxiety. No financial strains, the fear of falling because of balance, physiological problems, balance problems, the anxiety about speaking because of aphasia. I remember when I began saying, well, I need to go out in the street or out to places so I can expose myself and not be feel ashamed or difficult or like a strange person. So I began doing that. And I think that helped me a little bit at least. And then the anxiety is a common trauma sequel. I think anxiety still continues through the life of many survivors. And there's ways of dealing, at least helping to deal with anxiety too. So the post-stroke depression, it affects to 1/3 to 2/3 of all survivors. That's, I think, here in the United States statistics. It can be caused by biochemical changes in the brain. Depression can also be a normal psychological reaction to the losses from the stroke. And again, when the brain is injured, the survivor may not be able to feel positive emotions. That's just a few of the things that can happen. So brain injury is a family affair. I see this because it's part of my education and my profession was very involved with working with what we call family systems and systems thinking. And I still think that way and try to practice that and bring that into situations with families and individuals. So the family members of TBI survivors experience depression and anxiety between 20 and 40%. And the TBI survivor in the family can have impacts like reduced family income if you lose your job, etc. Reduce hours of work according to what your disability may be, or total higher levels of help-seeking behaviors as I can't work, I can't do, I can't swallow, I can't, all kinds of things that become difficult for the survivor. And family functioning can be impacted definitely by reduced affective involvement between the members of the family, communication and general functioning and role change. Role change, to make it clear, can be I've been there, I still have somehow, I need a little help from here and there, and some people need more from eating to smaller things like putting slides for a presentation and things like that. So my perspective as a clinician, again, is these are practical intervention modes, which this is what I've done all my life as a professional. And when I began rejoining my practice, which is these days is reduced to less hours, which is fine because I need to do other things that I will talk about further. I try to focus or retool my focus into call it my community sometimes, and I do that with a lot of affection and care. So put my individual skills for individual therapy to help an individual process, the trauma from the injury. That has a lot of levels, but none then is possible to facilitate the adaptation to changes and nurturing a new identity, which I keep announcing that I will get more into that. I'm part of that too in my own individual recovery. Family work, which also is something I've done for many years, to help the family process family trauma. Family work is not easy. I think you pretty much do a lot of what I used to call clinical sweating, but nonetheless it's challenging, but nonetheless it's very rewarding as well. So processing the family trauma and how you process the identity in family, meaning the identity of a family has changed or is evolving, and role reversal. As I said, people sometimes help other members of the family, hopefully, to get by, and the family adaptation to helping roles. And in group work, there's the therapeutic group and support groups. Now, I will talk a little bit about a support group that I've been doing or managing or facilitating for almost 3.5, 4 years now in a minute. But it can be incredibly powerful in the sense that it's very good to do exchange of information. Again, I said before that there's a lot of isolation. You're basically shut down from the world in some ways. And then you need to change and reconnect, making new contacts that can be from resources, from things that you need, your social milieu or your social group, which you lose. At least many people that I know with Afasia lost a lot of people. That's part also the dealing with the losses and the grief of what we missed or what we don't have anymore. So it's that kind of beginning to work towards that, call it new identity or new social place for you. So another mode that I can suggest or propose is a target small group psychotherapy, with a more pointed, if you may, therapeutic content to deal again for the trauma. This will be, in my mind, 3, 4, maybe 5 people. I think you need to manage a lot of dynamics there, and to deal with the trauma, the depression, the anxiety, the loss, and grief, and facing mortality. The facing mortality, for me, is become a very interesting point of explore, and I'll probably do something in the future. But I have shared that with other survivors, and your existence becomes not just metaphysical, but also you start looking about and this is not necessarily depressive, but just an occurrence of what I call the afterlife. But that's a conversation for the future anyways. But I find that very interesting, and at some other point there's people that are doing research those things, etc. But anyways, to finish, general loss, grief, and multiple family groups, which are psychoeducational in nature. I used to do those years before I had the stroke, but I would find them very useful with a few families and the members, and to call it a little bit of a mutual help type of group where people can again, exchange information, problems, and there's there can be a lot of problem solving in that type of environment. Okay, so now I get to Debbie Meyerson, which is when one of her books is called Identity Theft. Debbie was or is or was, I don't know if he's lecturing now. She has a lot of aphasia, but she had a stroke. And she was lecturer sociology at Stanford University. And she and her son, Danny Zuckerman, wrote this book, which has become very interesting to me. And she presents this, that since speech and language have to do with most of our activities in life, the loss of speech changes our identity, hence the title of Identity Theft. It's very provoking, I guess, anyways. But then she talks about rediscovering ourselves after a stroke. But anyways, the way we present to others and communicate with them is very important. We live that. So who you lived, you were has changed, and your function, your partner, family member, vocation, and social. So she goes on to talking about storytelling and what we call the narrative reconstruction. So there's a model. It's called it's a model of chronic illness and three common frames of mind. One is the chaos narrative, which is characterized by the loss of hope. The restitution narrative, which is characterized by a focus on recovery, and the quest narrative, which is characterized by the belief that illness is an opportunity for growth. Now, these frames are not 1, 2, 3. They're dynamic, and sometimes you can be in one and you can be another one. And this is a quote that she puts in her book. There also will be information at the resources. She has a very active organization online too. It's called Stroke Onward. But anyways, the quote is, "The narrative we tell ourselves and others dramatically influences how we act. So we are not stuck in one narrative, nor is it always a choice. But understanding that we have some agency in choosing our narrative has," she says, "helped me stay in the quest frame of mind more often, and I dig myself out the chaos a bit quicker." So that's a dynamic move, and I see that happening with me as well. I don't know, other people can talk about that, but I find this very very interesting and very provoking too. This is a book that I think is very helpful to help with aphasia and with cognitive recognition and syntax semantics. Some of you may know this type of works very well. And again, storytelling also it has a lot of role in aphasia recovery. And groups with different topics can help integration and may also help reconstruction, and reinvention of a new identity. So this is the group, the support group that I mentioned earlier, and this happens in Spanish. And it came associated with the Straw Combat Center, which is here in Virginia, not too far from where I am now. And it was born, excuse me, take a sip here. Born from need because I could not find many, if any, Spanish language speech therapists. And when you speak more than one language, I think many of you know that very well. And recovery, that can help you, if nothing else, with neuroplasticity and also with the culture, your identity too. So the people in the group are native Spanish speakers. Actually, most of us are also bilingual, if not multilingual, from different countries that we live in the United States. Now and then we get people from Latin America to join. And so different linguistics also reflect different languages, since we have people that have indigenous roots too in the group. So I think it's a very, very powerful and wonderful teaching and supporting group. We do a lot of validation. This happens, by the way, in Zoom, because we have people from different states in the United States and sometimes from outside of the United States now and then. And now and then there is also connections with some researchers. One of our members, I'll talk about her in a minute, got a new app in language in Spanish that was also being given to her for free, because she doesn't have a lot of money, from Boston University. And also I think that I know some people at the language lab at the University of Maryland that do a lot of research on the dual or dual language recovery in Spanish and other languages. Sorry, I got a little lost here. So, so surviving and thriving. What have I learned in 6 years? So I've learned that my body and my brain need, and my new narrative, it has to do a little bit sometimes with changed sensory experience. I hope I can explain it this well. And also, excuse me, the role of animals as helping survivors. So learning what my body and brain needs. My body needs good nutrition. It doesn't have to be very special, but it can be decent. It's not a junk food, as I call it here. And I do engage in moderate exercise. I have this wonderful black Labrador dog that is still on training, that is wonderful to go for walks and other things too. And I do a little light yoga to help stretch my body that sometimes gets a little stiff. And my brain needs rest. I do try to get sleep. I don't think everybody can do that sometimes, but I'm lucky enough. And I never in my life thought a nap, 20 or 40 minutes, was restoring. And I do that between say 11 a.m. and 3 or 4 p.m. And it really helps me kind of quiet and be able to continue the daily journey. And also something that I have done is to limit my screen time. I do get some contact with social media, having to do mostly with people with aphasia, but I do have to cut that short sometimes and be frugal with it, because, as I said before, I think there is a lot of anxiety left in in our community, and that's my way of managing that anxiety. And meditation is one of those ways that meditation, I don't mean that needs to be very esoteric or very special. I think you find or I find a place that is quiet, that is welcoming to me. Can be a chair, can be a mat or whatever. And I find that very, as the slide says, is it resting your brain or strength training for your brain? You guys can answer that. So the new narrative, an example of a site, I still have some problems with increased light sensitivity, and it's gotten better with time. But one of the things that I noticed is that my walks, I was looking and noticing things very differently than before, and began taking pictures too. And so when I go to my ophthalmologist, I tell him, well, what's going on with my eyes? He says, your eyes are fine. I think maybe something else. And he's an ophthalmologist. He's a very nice guy, but he doesn't want to get into other things that are not his discipline. So I think it's obviously the brain. I don't know. The brain does things. And in this case, I think that's wonderful. Wonderful things. I'm trying not to step on my dog there. Sorry. And I began entering my photographs in places, and got a few awards, and also I do every year for the last 50 years, I think now, I do a calendar that I kind of give to associates and other people with my wonderful arts, photographs, sorry. So dealing with the animals as partners in health, there's good research that underlines that pet ownership and can affect positively cardiovascular risk. And one of us that used to have a lot of, I forget that, I don't get it anymore. Hypertension, sorry. That benefit from that, I think probably a lot of people. So people with pets, this is a study that says that had significantly lower resting baseline heart rates and blood pressure, and significantly smaller increases in heart rate and blood pressure in response to stress, and faster recovery of those parameters to baseline after cessation of the stress. It happens to me, and maybe other factors too, but I think it's a good thing to think about and consider. And there's a photograph of a goat, and yes, goats in cases can be also good pets for people in recovery, people that need to be relaxed a little more. And here's my friend Belcha. Belcha in Basque means black. I'm from the Basque country originally, and he's been with me about 3 years. He's still a little bit on call it a training, and I call him now a working dog. He does a lot of wonderful things, including he's very sensitive, and if I'm a little stressed without saying a word, he's very able to come even from the floor downstairs. I don't know how he does that. I know they use this type of breeds to help. I know a couple of friends that are recovering either from PTSD or stroke that have also dogs. And these are members of the support group that I mentioned before. and their pets. So this is Ramon. He's a native, sorry, Navy lawyer, retired. He had a stroke. He has some limited mobility, and a couple of times a week he goes to an equine clinic, as they call him, I guess, and they help him ride Zach, which is the horse in the picture. And we've known each other for almost 3 years. He lives here in Virginia, and he reports that his aphasia has gotten much better in that he can talk better, and also his movements also have become improved. And the other photograph, sorry, is Jackie is one of the youngest members of our group. She's about 24 by now. And that's Spot. In Spanish would be Manchita. And she spends a good amount of time dressing and doing things with this cat, and also it's a good help for her as well. And lastly is Maria Paulina. She actually connects from Colombia, and that's Jack the cat, and he's so. With that, I think I'm kind of done. And you have any questions or whatever comments you want to say, please go ahead. How did I do, Scarlett?
Yeah, keep going.
Thank you very much.
All right. Sorry. Thank you again.
Mhm.
Thank you. Useful story.
So anybody
Do
has
you-
questions?
Do you have, thank you very much. Do you have some questions?
Réaction, peut-être.
Claude.
Moins question que réaction. Sorry. It's a kind of reaction from me, not so much a question. I had the stroke, but my wife got aphasia, both at the same time. So it's a very strange situation. I really enjoyed what you've been saying.
Okay.
Everything looks similar in a sense, but different partner, if you want. And I like your reference to Marison Zuckerman. The identity theft is very interesting as a concept. It's not a loss, it's a theft. In French, we would say with Gilles Vigneault, we both, my wife and I, were gens de parole et de causerie. We were speakers, we were teachers, we were university teachers. Now, in a sense, that's the end of it. We had to find out something else, a new identity, a new narrative, as you said. In a sense, my wife is not able now to speak anymore, but I have to be involved in something else. And the way I was involved, I became involved, it's with people with aphasia through Aphasie Québec through involvement in different groups of, as we say in French, proche aidance. It's a very interesting word, by the way. Proche aidance, meaning people helping people. It's important for us to be involved in something because we had so many losses, so many griefs. We used to travel. We used to go to theater, and that's the end of it. We can't go to these places. So we have to find new narrative. And I thank you because you gave me that kind of vocabulary. I enjoyed it very much, what you're saying. Thank you.
Thank you very
Merci bien,
much.
Claude.
Colin, oh, pardon, someone else? Colin, I said, wanted to say something, and then Marianne.
Hi, I thought it was very, very good. Well done. And I thought you get all of the points across was just very, very good. And I think it's good and bad for people with aphasia. Good is for you is to have those sort of talks. There's a lot of people with aphasia that they'd love to be doing something, but they can't because they can't get a whole sentence. But it's also very interesting is that it's obviously a very complicated brain. It looks like your reading and writing skills is okay. There's loads of people that I know they can't read and can't write as well as communication. So it's so I thought it was I just thought it was very, very good. That talk was about 45 minutes. It's quite interesting. A lot of people get fatigued? Are you going to be tired having a rest after it's finished? And you had to stop to get some water, all those sort of stuff. But you managed to get all the right words, and I thought it was very, very good. So well done.
Thank you, Colin. Marianne? Who wanted to say something? Sorry. Giovanni? I don't hear. Huh? There is no microphone.
It's open.
Now.
It's open. Goffredo, I would like to ask Javier.
Saverio.
First of all, I thank you for very interesting speech. I'm speaking because my wife is aphasic, and the problem is she speaks, she writes, but she has some difficulties to read. What would you like to suggest to improve this? And then what I was very impressed during your speech that unfortunately many aphasic people are alone. And in our situation, my wife has me as a caregiver, and I help, and she is very, what I can say, she's very diligent. She doesn't refuse to do something. She always also interested, but in any way, the life of aphasic is not simple, and I think we are in Italy and in Europe, our system of medical system is not very good, but there is something. In the States is not the same. And in any case, what would you like to suggest also to improve this? Thank you.
Right. I'll tell you what I'm not. I'm not a speech therapist. I think in some ways I had to come out of my own situation to expand my knowledge and what I need and what other people may need. This speech has to do with that, with reaching out and exchange information. I don't know anything, I don't have anything specific from what you say about your wife, because I don't have the skill to help her that, but I will remind you to some of the resources that I'll send after this to Jean-Marie so he can pass them.
Thank you.
And what I have to say is this. It may be not very helpful, but I think one thing that I have noticed, and that's more on the gut than on the brain with other people that have aphasia and have trauma, is I have met them because they have something inside that's some fire, some thriving, call it biological or not, but they want to get either out of where they are or where they are. So wherever you are, because we're in different countries, we have different resources. But if you need friends, look for friends. If there's I can't tell you better about your community better than you know. So I would say push forward and go ahead and look for things, because you're right. People are very intelligent, but just because they don't speak, that doesn't mean that they can. One of the things that I like to remind people in my group or in general is that to work with that sense of that a friend of mine says we are not irrelevant. So we try to find ways. We have to find ways of making ourselves irrelevant. This speak and this group is becoming more irrelevant again, or relevant. And because my sense was that people they can talk, and that's it. So you have to find ways, and there are many ways. You can do that through art. You can do that through. I have just my own through music is one of the things that helped me a lot too, because it just happens. So you have to find your own new narrative, if you may, and that's the best I can tell you. And thank you.
Thank you.
Thank you very much. Last question, Clotilde, yes?
Oui, Jean-Marie, tu veux me traduire?
I translate. Okay.
Merci, Gilles, de votre présentation. Moi, je suis aphasique depuis 10 ans. J'avais 37 ans. J'ai eu une rupture d'anévrisme.
Attends, je traduis. Thank you, Javier. I have aphasia since 10 years. I had a ruptured aneurysm. Mhm.
Moi aussi, je suis psychologue clinicien.
I am also a clinician psychologist.
Et ce que vous dites, ça résonne en moi, parce que pour moi, j'ai utilisé tous les appuis que j'avais en psychologie euh, euh, cognitive, euh, 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 clinique, mais c'est pas à la portée de tout le monde.
What you said, I also, as a psychologist, used all the methods I know for me and for the others, but it's not everyone who can do that. So, mhm.
Et moi, j'essaye d'apporter des choses en tant que présidente d'association française, mais les adhérents aphasiques s'en emparent ou pas.
She said, Clotilde say, I try to push the groups and the federation, the association of people with aphasia, but not all the people take that. Clotilde, I remember one Reto Strede from Switzerland saying, it's important for me always accept an invitation, never refuse an invitation. Un de mes collègues aphasiques ici en Suisse, en Hollande, me dit ne jamais refuser une invitation, c'est-à-dire toujours prendre la balle au bout. I don't know if it's true.
Je, je ne parle pas français très bien, mais Jean-Marie,